Good evening. I am Dr. Miaken Zeigler, and I want to thank you for being here today. Our time is brief, and Lord knows what it took you to be here today, listening to this workshop as we dive into a core principle of understanding your chiropractic care. But what happens when you are on the table getting an adjustment and how that differs from manipulation. My promise to you is that I have invested in being a really great chiropractor, a really good person, and that I need to deliver content and information that is relevant and supportive in terms of your care in my office. And the question I have for you is, what is your intention with being here? You're only going to get out of this what you are willing to receive. And we've got around 25 minutes of content. Are you willing, and are you willing to make the choice to grow? Everything we do, we are never static. We are always moving in one direction or the other. So the choices that we make, the time we invest in, and how we engage in our environment is either putting us towards growth, health, well-being, or putting us into more of a negative state, distress, dis-ease, right? So there's every choice we make. And by you investing in this time today and showing up and looking at really uplifting your ability to make more informed choices and have a better understanding of your body is opening you up to growth. So by showing up with an open heart and an open mind so that you can be your best is the best way you can spend your next 25 minutes. And I appreciate that you're spending it with me. So let's begin. I love this conversation about adjustment versus manipulation because I find that a lot of people use these two terms interchangeably, and they're actually very different. And when you get or receive a manipulation, whether it's through a healthcare professional or a movement professional, or it's something that you do on your own, very different from the adjustment. So today is really designed to understand, what's the difference. So let's just jump into the definition of manipulation. And these are Webster's definition. This is Webster's definition of manipulation, and it doesn't seem so bad. The act of manipulating something in a skillful manner. To treat or operate with or as if with the hands or by mechanical means, especially in a skillful manner. So the example that Webster said is you can manipulate a pencil, right, to write or to draw. You can manipulate a machine to, whether it's, a tractor trailer, something very large versus something much smaller, to create a more detailed end product. To handle, manage, or use, especially with skill and some process of treatment or performance. To examine or treat by skillful use of hands, as in palpation, reduction of dislocation, or changing the position of a fetus. So as I'm going through these definitions, there's a couple things that jump out at me. It takes a skill, right? There's definitely a skill required to manipulate. Typically using your hands in a very specific manner. They use the word treatment. We're going to get into that in just a minute, but understanding there's a treatment here or an examination, and once you've completed an examination, there's a treatment. Use of hands in a skillful manner. This is manipulation. So professionals using manipulation as a form of treatment. Those are osteopaths, so that is DOs, physical therapists, right? We have acupuncturists, we have massage therapists, we have trainers, we have Pilates and yoga instructors, right? All of those movement professionals, healthcare professionals use manipulation as a form of treatment. So let's just dive into manipulation for a second. Typically, when you are in conversation with any of these professionals, a lot of times they're evaluating the body and treating the body in a way where, is there restriction? Is there tightness? Is there muscle adhesions? And if that restriction is there, the treatment through use of hands and skill is to put movement and make, I guess, create more mobility within that area, right? So with osteopaths, they certainly work with the spine. Physical therapists work with the spine and extremities. Acupuncturists don't use as much manipulation, but they are taught it. I will tell you, I was in China for 3 months studying in a hospital, and manipulation was probably, 15% of the care people received. 60% was, it's probably even less than that, 60-70% was massage. Then they did cupping and acupuncture, and then manipulation was kind of the next tier that they would move to. So again, I want you to think about manipulation as there's restriction, there's lack of movement or mobility in an area of the body, and they're wanting to use skilled hands to create mobility and reduce that restriction, okay? Not a bad thing, it's just understanding that is what manipulation is, okay? Now, this is taken from a couple manuals from physical therapists and American Osteopathic Association. So physical therapists do not perform adjustments. So this is where it's important to understand the two. We do, however, utilize spinal and extremity manipulation along with manual therapy techniques and exercises. Again, here's the word, treatment of neuromuscular skeletal pain and dysfunction in order to restore mobility within these systems. We do not utilize manipulation to manage, co-manage, or prevent diseases or conditions in the other body systems. Okay, so that is PT. Okay. Osteopathic manipulative therapy. So your DO can effectively treat your muscles and joints to relieve pain, promote healing, and increase overall mobility. So again, big words here: treatment, mobility. We have neuromusculoskeletal pain. We've got muscles and joints with an end goal to treat pain. And when you look at the DOs, they say promote healing, but again, increase mobility, right? PTs, not looking to manage, co-manage, or prevent diseases or conditions in other body systems. So musculoskeletal, okay? So let's dive into chiropractic, okay? Chiropractic, very different from DOs and PTs. I mean, DOs and DCs, so doctors of chiropractic, doctors of osteopathy, actually had their birth time around the same time. Osteopathy is, I think, maybe around a couple of years older than chiropractic, but they got plugged more into our traditional healthcare system. So they tend to fall into traditional healthcare with prevention and treatment of disease. Chiropractic, we've remained and are considered alternative healthcare, but we've remained in our lane with, how we view the body, how we view care, and how we approach health and well-being. So chiropractic is a philosophy, a science, an art of things natural, okay? So when we talk about natural, we believe that there is an intelligence within the universe, an intelligence within the body. There's an organization, there's an ecosystem that works together. And when one is out of sync, it impacts the whole, right? The sum is greater, the whole is greater than the sum of its parts. So the way we approach the body is by adjusting segments of the spinal column. And this is the original definition, by hand only, but as the Techniques have evolved in chiropractic. We're seeing a much different delivery of adjustment. So we have instrument adjusting. So I use an activator, I use an arthrostim in addition to using my hands. And again, a system of adjusting the segments of the spinal column by hand only for the correction of the cause of the dis-ease. Not disease. This is body should be optimal health, normal health, healthy movement, balance, mobility, focus, concentration. Healthy normal function is ease within the body. When we see a body that's out of dis-ease or out of ease, we call that dis-ease. So not quite to disease condition, it's that middle period between ease and disease. Okay, so we go to the spinal column to make adjustments to correct that lack of ease within the system, to shift you into a more healthy state. So when we talk about philosophy, science, and art of things natural, it is philosophy tells us what is it? What is chiropractic? What is the foundation in which we view the body and the lens in which we view health? Okay. Our founder, D.D. Palmer, where medicine asked, what makes a man sick and how do we treat the sickness? Our founder, D.D. Palmer, asked, what makes a man healthy and how do we create health? Right? If you have a man who is surrounded by a group of individuals who all do the same thing, spend the same amount of time during the day doing the same activities, eating at the same table, living and growing up in a same work environment, why is that man healthy where the other one is sick? What makes that man healthy? So that was our starting point for chiropractic, right? The science and art. So how it's done and why it's done. So we have 33 principles. And the first and major premise, the first principle in chiropractic is there is a universal intelligence that is in all matter and continually gives to it all its properties and actions, thus maintaining it in existence. And so there is an intelligence, and within us, there is an innate intelligence. And that innate intelligence, the difference between you and I who are here breathing and somebody who passed yesterday, we have all the same body parts, right? We look the same, but there's that intelligence and that spark of life that is missing, right? So chiropractic is really looking at how do we work with that spark of life, that intelligence for you to better express life, well-being, health, right? Create more ease within the system. So again, very different than looking at treating restriction, treating immobility, and creating more movement. Okay. So let's dive into more here. So the adjustment. So DOs, PTs, massage therapists, Pilates, yoga instructors, they use the term manipulation. Chiropractic uses the term adjustment. Adjustment is very specific to correcting a vertebral subluxation. And subluxation, there's many different definitions depending on the technique and the chiropractor that you may use. But simplest terms, a subluxation is when you have a spinal column and you have a malalignment or a misalignment in the spine that places stress on a nervous system. It alters the input, the sensory input coming in, thereby altering the brain's ability to process information appropriately, and it alters output. Okay, so it's stress to the brain and nervous system that impacts how we respond to day-to-day life. And that response can be outward, that we can see. That response can be inward, that we don't necessarily see or feel. Okay, and if we break down what subluxation means in Latin, is sub is less than, lux is light, and ation has moved from center. So we're actually saying that a subluxation is less light and you've moved out of balance. which I really like if you like to get into meanings of words. So with the adjustment, okay, we haven't talked about treatment at all, and we haven't talked about musculoskeletal system movement. We've talked about brain, we talked about balance, we've talked about restoring and enhancing the intelligence within. So a big part of the adjustment is intention. What is the intent with you laying your hands on my spine or my body? So the adjustment to correct subluxation with the intent of restoring function, enhancing life expression, and optimizing your potential. And so I had a chiropractor who studied philosophy, studied biomechanics, and studied thermodynamics, and came up with the adjustment equation. And I love going over this with people because there is so much behind what the adjustment can do in terms of when the intent is appropriate and the reception is appropriate for you to experience a different end result. So the adjustment equals the consciousness of the patient. Okay, so what that means is, what do you as a patient, as the person receiving the adjustment, what do you believe that adjustment is going to do? Do you believe that it is going to increase mobility and movement? Do you believe it's going to take away your pain? Do you believe it's going to move you in the spectrum of health and disease? Do you believe it's going to move you towards health, ease, expression of life? Do you believe it's going to move you towards a potential that you know you have the capacity to experience, but maybe the stress has not allowed you to move towards that, right? There's tiers of consciousness of what your expectation can be with the adjustment. Same with, what is the consciousness and intent with the chiropractor, right? When I am laying my hands on your spine, is my intent just to treat immobility, treat musculoskeletal pain? Or is my intent to improve function, restore health, move you towards potential? Because I believe that you can never put a cap on the potential of a human being. As long as they are living and breathing, there is a potential to express a greater level of health. So what is the consciousness and intent of the chiropractor? Multiplied by the force of the adjustment, whether it's by hand, whether it's a tool, the adjustment input into the system to change and alter the input into the brain to help support better processing and better response to your environment. Okay. Plus coherence. I love coherence. So think of coherence as a flock of geese or a school of fish, or you've got an orchestra, 100-piece orchestra where they are playing this beautiful, immaculate piece and they're all playing as one, right? That is coherence. We have trillions of cells within our body, and those trillions of cells, when they have a higher level of coherence, they're working together and working as one system. That's the goal of chiropractic, is we want to increase your coherence of the system, your trillions of cells working together as one, working as an ecosystem, right? And we want to reduce the entropy. So entropy is the level of disorganization or chaos within the system, right? The cells that are going off and doing their own thing, right? So the adjustment is talking about brain and nervous system function and altering the process, or altering input in to alter how your brain processes your environment and changes how you respond to life, which is so cool. So you can have increased stress, right? Let's say this is stress here. If you have a level of coherence and resiliency, adaptability within the body, stress can go up and down, but your processing and your response to that, no problem, right? That's what the adjustment was meant to do. Very different than let's just put movement into a spine or movement into a joint to create mobility. Okay. And just a side note here, because I know that I have quite a few people who I see in the practice or in the office who tend to just, I know it feels really good whenever I just kind of like, you know, move my head or kind of just put some input or really kind of twist things. I get that pop and it releases and it feels a lot better. That is a manipulation. That is you trying to put input into an area of restriction to get some relief of pain. Here's the thing. Oftentimes when you do that, I mean, your hands and that movement is not a skilled movement, right? It's, you know, it's kind of like just cracking your, you know, your knuckles. It's putting movement where you feel restriction. You can oftentimes create more challenge or more problems within your spine when you do that, because what's happening is you're moving a mobile joint. You're moving a joint that's pretty stable. But as you continue to do that, you start to create some instability within a joint that was fine. So I have some people who say, oh man, I used to do that all the time. And I get a nice release and I feel better. Now it's like I can't get that movement. I don't get that release, or I don't get that level of pain relief. And that's because it has progressed to more stress within the body, and your manipulation is, you know, no longer supporting pain relief. It's no longer giving you that mobility that gave you relief before. So adjustments are very different. You know, you may think, oh, I'm going to go in here and this person is going to, you know, put mobility and input into this area, and I'm going to feel tons better. That happens, but it doesn't always, because again, we are looking at input into the system to correct subluxation, to change how the brain is processing information. And when your brain is better processing information, it changes the neurology, the organization within your body. And guess what? You're moving towards health. It just doesn't always happen like that, because it probably didn't take, you know, that amount of time to get to where you are today. So let's just talk about this, because I think it's fascinating to see, you know, what research has shown in terms of when you receive an adjustment to correct subluxation, how it improves brain function. This is all research coming from Heidi Havoc. She's out of New Zealand, and she's doing some really cool stuff. A lot of times they do brain imaging before and after an adjustment. They do these functional movements and things before and after an adjustment. So following an adjustment, they see improved or altered visual acuity, so your ability to track, and visual field size, which is super cool. We see changes with the eyes. We see reduced joint position sense error. So your brain's ability to know where your arm and leg are, even though your eyes are closed, right? These are big joints. But when we're talking about joints in the spine, much smaller joints, more stabilizing joints, that's a big deal. We see decreased reaction time. So think about, you know, this is why professional athletes have chiropractors on their team, because you see improved performance with an adjustment, right? If somebody can react faster to whatever's in front of them, they're going to be performing better. So we talked about altered brain processing, changes in the way the brain integrates information coming in and therefore information going out. We alter the spinal cord excitability. So excitability oftentimes can be stressful. And it depends on the person, because sometimes we can see, you know, reduced tone and compressive-like forces. Sometimes we see lots of activity. So it depends on the person. They might need increased excitability, they might need decreased. So it alters that. Changes specific messages that get sent to muscles from the central nervous system. So that's where we see increased muscle strength in legs. Do we see it in arms? We don't know. The research just hasn't been done. But one thing I do see is we test your grip strength following, you know, for exams, initial exams, and a lot of times we see grip strength changes because it indicates what's going on through the cervical spine. Reduced or prevented muscle fatigue developing. Again, this is why athletes love getting chiropractic care before and after they perform, because we see improvement in performance and we see improvement in recovery. This is all from an adjustment, which is super cool. Improved function of the body. Bigger than that, improved function of the brain. One thing that I don't have in here, which is one of my favorite pieces of research, shows that when you get adjusted, they did scans of the brain before and after an adjustment, and they found one adjustment increased your brain function of your prefrontal cortex, which is your executive function, by 20%. 20%, which is so cool. That is goal-oriented tasks, focus and concentration. That is let's see, how you perceive pain, how you respond emotionally to your environment. It is your stress management, your autonomic nervous system, decision making. I mean, it is executive function of the brain. So we see that change too, which is super cool. And the last thing I want to just, let's see how much time we have. I just want to touch on, because we heard, you know, when we were going over the difference between talking about manipulation, they use the word treatment pretty much in every definition, right? We are treating lack of mobility and restriction. So treatment is very much in the traditional healthcare model, where if there's an injury, if there's an illness, if there's a condition, we're going to give you a treatment to address this condition, right? We're treating you, it's an outside-in approach. You need this to get rid of this, okay? In chiropractic, we don't use that term. We don't see you as somebody who needs treatment. We see you as somebody who needs support and different tools for your body to express health differently. So we're not treating low back pain. We're not treating headaches or migraines. We're not treating sciatic or radicular pain, okay? We are looking to correct the subluxation, remove interference or stress between the brain and the body, and allow the brain to better express health, allow the brain to better respond to your environment. And so we like to use the word care. Okay, care, the definition, the provision of what is necessary for the health, welfare, maintenance, and protection of someone or something. Okay, so in little pockets or little gaps of time, I mean, when people come in pretty acute pain, okay, well, yes, we are going to do pain-based care for, you know, a pocket of time treatment. Okay, especially if we're routing through insurance or personal injury, okay? That's why we see you frequently in the front end. But bigger umbrella, we're looking at, there's care involved. And there may be these pockets of needed treatment to help your body recover and heal. But the overarching piece is we want to support the care of your body and the health of your body. Okay, that is a process and that is a journey that is forever long. What you're choosing to do now to take care of your body is what you see end goal wise. So if you are invested and you are showing up and you are consistent with things that uplift your health and well-being, right? Moving your body, giving your body good nutrition, hydrating, stress management with meditation, journaling, breath work, right? Getting your chiropractic care, doing massage therapy, doing spinal hygiene movements and exercises. That is caring for your body on a day-to-day basis. And that changes the trajectory of life, your life, and what you could experience. And we're all caring for our bodies to a degree. You know, there's people who have chronic disease and end up needing treatment because of diabetes, high blood pressure, high cholesterol, cardiovascular disease, heart disease. obesity, right? They've, to a degree, cared for their body, and need significant treatment at some point once their body has shown those indicators that they are to that degree of health or lack thereof. So understand, when we're talking about chiropractic and we're talking about the adjustments, we're really looking at that as care. It's a much bigger umbrella to care for your body, your health, your well-being, and looking at supporting that down the road. So if there's anything that you get from this, number one, I hope it's a better understanding of your chiropractic care. But number two, I hope that maybe it's inspired you to think about somebody that you love and care for that hasn't gotten their spine checked, that needs it. Because people who go to chiropractors are healthier. And I know that you probably want your family, your friends to be healthier. Because if there's anything that we need right now with the world today, it is a healthier, more resilient, more adaptable community. Because certainly what we're challenged with these times of COVID, these times of isolation and lack of community, these times of, people unemployed, is we need to change the foundation of health, and moving forward, when people are healthier and better able to process appropriately what's going on in their environment, it changes the trajectory of life for them and their families. So my challenge to you is, if you know somebody who's never had their spine checked, please share with them what you know, and please send them in, because we want the best for you and we want the best for our community, because we love and appreciate you. So thanks for being here today. I appreciate all of you, and I hope that you choose to share your takeaway in the office next time you're there for your visit. All right. We'll see you later.